You could call them the Affordable Care Act class.
The whole Affordable Care Act is about team medicine.
The primary goal of the Affordable Care Act is to increase access for patients around the country. The primary mission of the Frank Netter School of Medicine is to train students who will practice medicine, hopefully in primary care settings.
We're trying to emphasize to our students the importance of teamwork in medicine. So we are doing a number of things. We organize what we call interprofessional educational events, which brings students from health science, nursing, and medicine together. Some of it is just to familiarize themselves with the roles that those individuals play in the healthcare system.
Over the years, medical students nationwide have opted to enter into higher paying specialties, which has created a shortage of primary care doctors. When we sat down with Bruce Keppen, the dean of the Frank Netter School of Medicine at Quinnipiac University, he told us how he thinks we can put an end to the shortage.
Improving access. And the best way to improve access is to get people seen in primary care settings.
One of the main goals of the Affordable Care Act is to provide more primary care physicians, which aligns with what the Quinnipiac Medical School is preparing their students for.
The current model is more the NASCAR pit crew, where you have a group of highly skilled individuals, each with very specific expertise, all coming together to take care of the car, but just substitute the patient for the car. I think our students are going to be excellently prepared to be able to move into that environment.
The Act has many provisions to enhance the delivery of primary care services to patients, such as patient-centered medical homes, where you can see providers from different backgrounds like nursing, physician assistants, and physicians all working together to help the care of the patient.
These are larger teams of organizations, all focused on providing effective, efficient, high-quality patient care.
Dean Keppen told us not every patient in these settings needs to directly see a physician. Patients can easily be handled by a highly trained nurse practitioner or physician's assistant because they are fully capable of treating the patient's need.
What it does, it allows that setting to see more patients because not every patient has to be seen by the physician. But the patients have to recognize it as if they're not seeing the physician, they're not getting substandard care.
The Affordable Care Act will include many opportunities, challenges, and changes, but the Frank Netter School of Medicine is confident that they are training the future health professionals to be prepared for what's ahead.
We have to train all of the health professionals, whether it's a medical student or a nursing student, to be adept at what we call lifelong learning. They're constantly learning. And many states have a requirement to retain your license. You must log so many hours of what we call continuing medical education, so that the latest advances are being brought to your attention, and that's already occurring as the people are getting ready for the provisions of the Affordable Care Act.
Supporters of the law believe that if there are more primary care physicians, it could mean more patients will be able to get preventative care rather than taking expensive trips to the emergency room.
So it's to build the workforce that this country desperately needs.
Bianca Dux, Q30 News.